Good morning, everybody, and welcome to Real Estate Live UK. We're back with you here this morning and, in fact, for the next 3 days. And thanks for joining us for this opening session, which is our UK Cities Keynote. Now, the Real Estate Live programme takes place 3 times a year and is brought to you by White Label, our partners and sponsors. And for this edition, we're moving away from being fully virtual as a programme as we head to Liverpool tomorrow for an exclusive in-person investor roadshow. But don't panic. If you're not in Liverpool, you can watch all of the main plenary sessions online live as they happen, as always, for free. Now, just before we get underway, we'd like to thank all the organisations contributing to the panels we've got taking place this week. And places across the UK will be showcasing themselves to investors and developers, and industry-leading experts will be exploring ideas on how the property and regeneration sectors can continue to thrive as we discuss the programme's key topics, including free ports, the rise of the industrial and logistics sectors, and the role of culture in creating and sustaining communities. And you can find out much more about Real Estate Live UK by visiting our website, which is, of course, www.realestatelive.co.uk. But right now, we're heading into our UK keynotes session, and as we ask, what do UK cities need to create and grow a life sciences hub? And just before we start, just like to remind you that we want you to be really interactive with this session. We'd like you, the audience, please feel free to ask questions, and you can do that using the Zoom's Q&A function, which is at the bottom of your screen. And now I'm really pleased to hand over to our chair for this session. Please welcome Ellie Junod, who is Associate Director, Life Sciences at JLL. Over to you, Ellie.
Thank you, Catherine, and good morning, everyone, and welcome to today's Real Estate Live panel event. Thank you for tuning in to today's webinar, where for the next hour, we will be discussing what UK cities need to create and grow a life sciences hub. So, as many of you will be aware, life sciences is now an integral part of the government's economic strategy for the next coming decade. And whilst the sector was on an upward growth trajectory prior to the arrival of COVID-19, the pandemic experience has highlighted the somewhat overlooked importance and opportunity presented to the UK, both in terms of our ability to create and grow highly innovative companies that produce novel and pioneering therapies and treatments, but also for the real estate sector, who have a growing responsibility to provide appropriate spaces for these companies. Therefore, with today's fantastic panel, we will look to explore what are the components needed within a city to attract life sciences businesses and their employees, which cities have established a tangible, credible strength in the sector, and how has this been achieved? And finally, what are the biggest opportunities and challenges facing this dynamic and rapidly growing sector? So to introduce today's panel, I have with me Rachael Patterson, Policy and Marketing Manager for Liverpool's Knowledge Quarter, Councillor John Alexander from Dundee City Council, Dr. Suki Balendra, Life Sciences Lead at the NIHR Clinical Research Network, and Georgina Rizik, Executive Director at SC1, London's Life Sciences Innovation District. Unfortunately, we're also meant to have Simon Sweetenberg from DIT, but sadly he tested positive with COVID and isn't feeling very well, so we hope he gets better soon. And finally, it's already been mentioned, but I'm Ellie Junod, and I'm an Associate Director in the UK Life Sciences team at Jones Lang LaSalle JLL, and we're a global real estate and financial services company. Right, so to kick off, Rachael, I'm going to come to you first. So the Knowledge Quarter Liverpool is about 450 acres of an urban innovation district that occupies about 50% of Liverpool city centre. So 2 questions for you in one, really. So first of all, what does innovation mean to Liverpool? Presumably more than just life sciences, we're kind of seeing the definition of boundary of life sciences being pushed. And what are some of the key factors that have made the innovation district such a success?
Thank you, Ellie. I'll start with the second question first, if that's all right. So the Knowledge Quarter Liverpool was established in 2016, and it was brought together to basically position Liverpool as a world leader in health and life sciences and push forward our specialisms. But it wouldn't have been possible without the cross collaboration between our higher education, so at the University of Liverpool, Liverpool John Moores, bringing in the public sector with Liverpool City Council and the Liverpool City region. We've got the School of Tropical Medicine on board, the first School of Tropical Medicine, and a real collection of partners that have been able to come together, collaborate in a way that has meant we've been able to create new spaces within the innovation district. So we've created a new life sciences campus, Paddington Village, to help our businesses grow within the region, but also to help attract new investors and new occupiers into the city, creating more jobs for the future, creating a life and experience for young people to grow up in the city and work in the sector. So there's a lot of different moving parts within an innovation district. Certainly the partners is a huge one. The talent, so the student population, the University of Liverpool, School of Tropical Medicine and John Moores have both got fantastic student populations, and we've got to make sure we try and retain that talent within the sector, but also having the ability to come together and create an excitement around health and life sciences. Especially when you're trying to inspire young people and inspire people to come to the city and understand what's happening here. It's about creating that buzz, creating that excitement. And to be able to touch on the first question, what does innovation mean to Liverpool? It's an interesting one because absolutely it's more than just life sciences. And I think Liverpool as a city has always been, it's always been innovative. And it does that through its culture, through its regeneration of its central business district, and even just the way Liverpool conducted the mass testing pilot that took place in November 2020. It was ran like an event. It was ran like a cultural event. And nowhere else could that have happened in the same way it did. And Liverpool's people showed a real determination to be innovative and to help fight against the COVID pandemic. So I think, innovation, absolutely, it's more than just life sciences, but we are lucky in the city and within the Knowledge Quarter that we've got fantastic work. We've got fantastic academic partners who are breaking boundaries with new research projects every day. But we've also got we've created innovative spaces for people to work in as well. We've got the new spine, which I guess it's not new anymore. It's been open for 12 months, but we still say it's new. And with the way that's been designed, with its well standard, that is, it's lined up to be one of the world's healthiest buildings. And that's, creating innovative spaces for people to come and work. And it's not just about, your typical innovation within health and life sciences. It's about all of the components of a person's life and how we can bring all those components together. Oh, I think Ellie, you're on mute.
Can you hear me now?
Yeah.
Perfect. Sorry about that. Yeah, I totally agree. It's more about just kind of building some labs and some real estate. And John, if I come to you next with kind of what Rachel's just said and kind of what are or were some of the key considerations, kind of you're more at the early stages, but what are Dundee considering when you're kind of developing your science innovation district, and how do you think this is going to fit? How do you think Dundee is going to fit into kind of the wider Scottish life science landscape?
I think it's a really interesting question. And obviously, no matter which part of the UK we talk about, we'll be wrestling with the same challenges and looking at the same opportunities in many senses. And that is about talent, it's about quality of research and output, and of course, about infrastructure. And it's probably the last one that I would focus on the most. But if you consider Dundee as part of a very innovative region, so within a 20-minute radius of the city of Dundee, you have 4 universities, including the University of St Andrews and the University of Dundee, both exceptionally well-renowned, world-renowned indeed, university locations that are creating a wealth of talent that the city is benefiting from. Based within the city, the University of Dundee, we've got 900 scientists from 50 different countries working on pharmaceutical, biomedical research, on a daily basis so that we have the talent. We know the quality of research is second to none in various league tables. The university consistently ranks as one of the highest, not only in the UK, but in the world. The State of Innovation report by Cllr Analytics ranked Dundee as the most influential scientific research institution in the world for pharmaceutical research. So we know we've got the talent, we know we've got the out. Key thing now is considering the infrastructure and also thinking ahead of what our requirements will be, not now, not just in 5 years' time, but in 10 and 15 years. So anticipating demand and need is absolutely where our focus is at the moment. Again, it's one of the biggest challenges, particularly when we're looking at the challenges of kind of inflationary pressures and construction inflation, but it's also a unique opportunity for us to build a successful and kind of ongoing growth within the sector in Dundee as well. And I think when we consider the infrastructure, it's not just one type of or one size of development either. It's about making sure that we have innovative small-scale labs for spin-out companies and then enabling them to grow throughout their success story, hopefully.
Thank you. And Georgina, that takes me nicely on to kind of coming to you next. You've and there's kind of a growing theme here. You've been appointed with a very kind of exciting but tricky role of creating a life science district in South Central London. And the initiative was founded by King's Health Partners, Guy St Thomas's Foundation, Lambeth and Southwark Council. How do you go about taking all the aims and objectives of so many stakeholders, combine that with kind of the private sector life science landscape, bundle in the kind of mixed and compact real estate ownership within London to create a cohesive and thriving life science ecosystem?
Yeah, thank you. It's definitely a very exciting opportunity. And that really is the objective, to achieve cohesion. So you're absolutely right. I have an incredible foundation to build on with the founding partners that you've nicely mentioned. It's actually comes down to we are already aligned on our vision and our mission in terms of what we want to accomplish. So let me share with you our vision for SC1. And there's going to be a few keywords here that I want to build on. We want to create a transformative life science ecosystem in Central London, dedicated to innovation, creative partnerships. And this is the really important part, to improve life for our local and global communities. So what that means is a couple of things. Innovation is really the price of admission. Any innovation district in the life sciences has to have innovation. So again, we're built on the foundation of King's College London, a world-class institution. And I think you've already mentioned our 3 trusts as well. We also have the foundation. What I want to highlight here is we're focused on creative partnerships. And what that means is looking for partners in the private and public sectors that are aligned with this vision. And the most important part here is to improve life for our local and global communities. What that means is we have the privilege here of Lambeth and Southwark, 2 of the most diverse boroughs in South Central London, if not the UK. And they're an incredible opportunity for us to engage proactively with our 2 boroughs to build up this ecosystem. That's really our vision. If I were to dig a little bit deeper and to achieve this cohesion, we are also already aligned on what our mission is. And our mission is really quite simple. On a daily basis, what we're trying to do is reimagine innovation and health equity. So anytime we look at doing anything from a big picture perspective, we're asking ourselves, is this really different? Is this really innovative? And more importantly, we have the health equity lens to it. So I think to answer your question, once all the founders, we are aligned on our vision, we are aligned on our mission, the rest becomes really about fine-tuning the strategy, which is my job to work with the founders to fine-tune the strategy and then get into execution. And it's really to find the common ground, because right now a lot is being done across the founders, and it's really about what can we do that's maybe on a larger scale that benefits the local community, but also benefits and becomes an exemplar for the global community. So that's really our vision and our mission. So once you align on those things and we're already there, the rest really becomes about, as cliche as it sounds, really exceptional execution and finding the partners who are aligned with our vision and mission.
Great, thank you. And Suki, So we've heard now about 3 different geographically located innovation districts, kind of Dundee, Liverpool and South Central London. And I know Imperial NHS Trust is in the midst of creating a campus in Paddington. So if you could tell us a bit more about that, it'd be great. And what do you think kind of across the UK is kind of the common theme that is kind of making all these these innovation districts successful, and what's kind of attracting the talent and allowing these locations to thrive?
Thank you, and thanks so much for the invitation to be a part of the panel this morning. So, as you said, I'm part of the NIHR Clinical Research Network, and we're hosted by Imperial College Healthcare NHS Trust. And the trust has hugely ambitious plans for the future. So, compared to some of my colleagues on the call today, we're probably at the earlier stage of the journey in terms of creating a life sciences campus. So Imperial sits in northwest London. We serve a population of just under 2.5 million. And of that 2.5 million, as others have said, we have a hugely diverse population. So just under half that population comes from a diverse background. We speak many, many different languages in northwest London. And that's reflected in our staffing structure as well. So we have 14,500 members of staff, and that culture and that diversity is represented in our staff as well. So, you know, we're hugely proud of the trust and the research and services that we provide. But if you go to our buildings right now, and if you've visited our hospitals recently, you will see that we're in need of major investment. And those plans, you know, are well underway, and we are part of the government's ambition for 30 new hospitals by 2035. So we're comprised of 3 main hospital sites: Charing Cross, Hammersmith and St Mary's. So Charing Cross is a major urban general hospital and the base for some of our undergraduate teaching. So our plans is part of refurbishment at that site and creating new buildings. We also have Hammersmith Hospital, which is a bit more in the corner of northwest London and already has really good links to the White City campus, which some of you may be familiar with already. So that already has that connection there and promoting that research innovation landscape already. But we also want to refurbish and redo that Hammersmith Hospital. There is already maternity services there that are world leading, and I can testify I had my second child at Queen Charlotte's Hospital at that site. And then there's St Mary's. So St Mary's Hospital in Paddington is part of the vision for this life sciences campus. And our aim is to create, 140 new beds with a real focus on acute care. And there's so much opportunity in that landscape for academics, clinicians, industry to work together. And we already have a really strong base there. There is already life sciences companies that have their head offices there, like IQVIA, Takeda, Vertex. And so we're going to build on that foundation that's already there. And I can't say too much, but there will be announcements in the next few days and months ahead about some of the plans we have for Paddington. And my day job, really, my real, the thing I spend a lot of time on is clinical trials and clinical research. And Paddington offers huge opportunities for us to be able to test new treatments in that hugely diverse population. And one point that I think is really important is that patients, you can't expect patients nowadays to always come into specialist facilities to be offered research opportunities. You have to offer opportunities for patients to get involved in research in the communities that they live and work in. So whether that be patients going into a pharmacy, a school, in their care homes, in the GP practices, our ambition is that the research infrastructure is for the whole community.
Brilliant, thank you, and teasing us with the announcements. Rachael, if I could come back to you and kind of also more to the general panel, if anyone has any thoughts. do you think it's important for a cluster to have a USP? So, Stevenage with its cell and gene therapy is a good example, kind of built off the GSK campus, and now with the cell and gene therapy catapult there. But for example, when you created Liverpool's innovation quarter, I think you kind of selected a couple of key specialisms. Why did you think this was important for the innovation cluster, and how did you go about deciding this?
Yeah, I think absolutely it's important to have USPs. It's what defines us, and it's what also helps us be able to collaborate nationally with other innovation districts and not always be direct competition. So there's certainly a piece to look at there. I think our specialisms, specifically, it was brought forward a lot by the 2017 Science and Innovation Audit. Liverpool's specialisms were, preventing infectious diseases, and materials chemistry, among others. And I think what that has allowed us to do is to really focus in on those specialisms and create new businesses, attract new startups, that sort of thing. And I'll use two examples. The first being the ICON, which is the Innovation Infection Consortium that's run by Professor Janet Hemingway. That has been brought together because of Liverpool's world leading specialisms, because of the reputation of the School of Tropical Medicine. And that's brought partners from all across the UK together, but they're innovating in Liverpool. So that's a fantastic example. And, the work they've done so far, they've brought over 2 billion products to market, and they now operate over 40% of the malaria net market. So, they're doing really powerful things, and that is all built on that specialism. And the second example is the Pandemic Institute that was created in September last year, and that brought together a load of Liverpool's partners, once again, including the universities, the NHS Foundation Trust, and the School of Tropical Medicine, the City Council, the City Region, brought together all those key players to position Liverpool as the place to look at preventing, predicting, and recovering from pandemics in the future. And I know they're now looking at a piece around monkeypox. So it is, they're moving forward, and they're really tapping into those specialisms, but sort of projecting that on a national scale. And there are other institutes across the UK and across the world, and the whole point is that they're collaborative across the region. So we've got our specialisms, but we cross collaborate because we learn from other places as well. I think the other thing is when we're looking at attracting investment into the city, attracting new occupiers into the city, especially as we're moving forward with our new Health and Life Sciences campus with Paddington Village. It's important for us to be able to look at the assets we've currently got and create an ecosystem around them, to ensure that we're attracting the best investment into the city. And I think, especially when we're looking at the markets like the US, which, their cities are absolutely huge, I think we can look more at how Liverpool can collaborate with its neighbours in Manchester, its neighbours in Cheshire with Alderley Park, and how, we've got specialisms, Manchester has specialisms, Cheshire has specialisms. Actually, if we were to collaborate across the regions, we'd be able to attract some really, really big players into this space. And, using the US market as an example, they would see the geographical area that we're looking at as one city. So I think having those specialisms really defines us. And I think it's given us the ability to position ourselves nicely, to further collaborate with different city regions, but also to build on those specialisms with startups, creating talent, to really push us forward.
Yeah, totally agree. And an interesting point around investment. Georgina, did you have anything to add on that?
Yeah, I actually have a lot of thoughts on this because I'm very passionate about the concept of having a value proposition. I think when I mentioned our reimagining innovation and health equity, that is fundamentally our overarching value proposition, to do both things and to do them very well, because I think there's a lot out there that's being done, but not together. And back to your question about specializing. So again, back to SC1, we have the privilege of having 3 incredible hubs. So the first one is at Westminster Bridge. It's called our Medtech Hub, where we have our biomedical engineering school. where we have St. Thomas's Hospital, where there's also KHP Ventures. There's our AI Center for Value-Based Healthcare. I could go a list of about 10 to 15 exceptional things that are going on there, but in the spirit of brevity, I also want to move on to our second key innovation hub, which is known as our Biomedical Hub, and that's along London Bridge. And again, that's where our Faculty of Medicine and Life Sciences is. Guy's Hospital is there. We've had several spin-outs as well. And then thirdly, and quite importantly, we have our third hub around Denmark Hill, and that's focused on neuroscience, the brain. Some incredible work has come out of SLAM, as you know. They're, been on, I would say incredibly proactive over the past decade in terms of mental health, and that should be duly noted. So I think that's how we see our overarching value proposition, reimagining innovation and health equity. But we have 3 incredible hubs that really address nuances around certain specializations and therapeutic areas. Equally important, and I'm not sure if we're going to have time to get into all this, but I think it's really important, is we have about 8 real estate developments in the pipeline right now to address the growing needs for incubator space, lab space, office space for all these spin-outs, for all these entrepreneurs. The most that are on our radar right now is Royal Street out of Westminster Bridge and Snowfields coming out of London Bridge. And that's really an example of where we're trying to align our big picture strategy along with our real estate strategy so that it all comes down together. And it's quite frankly future-proof. So not only does it address the needs of what we need a year, 2 years from now, but 5, 10 years out, and it has that flexibility as well. So great question. And I could talk about it for hours, but in the interest of time, I'll respect my panelists and give them an opportunity to address this really important question.
Thank you. Yeah, very good points around. We'll try and come on to different types of life science space if we have an opportunity to do. But Suki, did you have anything to add around that, around specialisms?
Yeah, I was just going to say, I think it really is important to have a USP and a narrative that you can build your story around about the centre that you're talking about. The other point I wanted to make was about disease burden, that it's so important to actually reflect your priorities based on the disease burden in the population in which you serve. So, for example, in Northwest London, we know that we have an unusually disproportionately high level of diabetes, stillbirths, sickle cell. And so these are the areas that we want to focus on in the future. So, yes, there's academic specialties and their expertise, but also there's our population and the areas that they need us to focus on for the future.
Thank you. Yeah, that's a really interesting point, because I feel like the focus normally gets fixed on what's the academic USP, what's the university producing. But yeah, that's a really interesting point around the landscape of what's happening there. If I can come to you again, Suki, I think bringing it to kind of the infrastructure, I think, well, not just the infrastructure, but manufacturing is a part of the process that quite often gets missed off the list when we're talking around life sciences innovation. But 2 kind of questions for you. First of all, do you think there's a greater need for manufacturing in the UK, kind of both on the pilot level scheme and the mass production scheme? And kind of what does this mean in relation to talent specifically, but also infrastructure across the UK?
Great question. And actually, I started my career in manufacturing. I worked in Abbott Diagnostics for 5 years in Dartford in Kent, and we were manufacturing ELISA assays to test for things like HIV, hepatitis. And, the plant that I worked in is no longer there. It's all flats. And I think that says something, in Kent as a whole and across the UK, we've seen the manufacturing footprint reduce over the years. But there is some good news on the horizon. I'm sure many of us would have seen on the news recently that Moderna has chosen the UK to base its mRNA innovation and technology centre. And I think that kind of investment news is really, really promising, and hopefully it will stimulate even more investment in manufacturing in the UK. I think it is an important part of the story for the UK. And as I said, we've seen a reduction in the manufacturing capabilities in the UK, just in terms of some of the plants that we had have severely reduced. So I think that's, I think there's positive news on the horizon. The other thing about talent is that, we actually have, and, I'm testament to that myself, the skills that we have built up in the lab through our degrees and PhDs and, masters are all applicable to the manufacturing setting. But there isn't often the opportunity to go into those industries when you leave university. And it's sometimes not the obvious choice for young graduates. So the more that we can stimulate that, the more opportunity there is for some of our young people.
Great, thank you. And John, did you want to add to that? Because I think Scotland is quite strong on that front.
Yeah, absolutely. And I think just to agree with what Suki says as well, I think there are opportunities, and particularly when we consider the context of the last 3 years with a lot more onshoring of some of that development and the manufacturing assets that are in the UK. I think we're going to continue to see that grow. Within the Tayside region, of which Dundee is the centre, we have a major manufacturing centre in GlaxoSmithKline in Montrose. And again, the connectivity between the research and the output from our academic institutions, the commercialisation of some of those companies and the manufacturing is absolutely integral if we're to make the most of the life sciences sector, both from a health and socio-economic point of view, but also just in terms of sustainability and continued growth. So I think there are significant opportunities, and it's making sure that we do connect the various elements together, because if we only look through this through a very narrow prism and focus on one aspect, whether it be manufacturing or infrastructure or academic output, then we actually lose sight of the totality of what we can achieve. So yeah, just to wholeheartedly agree with those comments.
Yes, definitely. It's definitely something that we're going to need more of in the UK. Georgina, if I can just come to you, you've worked, well, along with many other parts of the panel, but you've worked in the life science industry for a number of years, but you've also worked kind of globally. Are there any particular kind of areas or districts where you've seen or worked in where you think there's a true kind of example of a true ecosystem kind of covering all parts of the life science ecosystem? And do you think there's any kind of key lessons that you think we can take away from that and you can put into, say, SC1 that you're developing now?
Great question again, Julie. So yeah, I've had the privilege of working globally, both in Canada, Europe, and the Middle East. And so I'll reflect on the first one, which is a very obvious example of the gold standard that everybody reflects on. And that's the Boston ecosystem, and rightfully so. So I'm not going to belabor that because I think that's well established. They're at the forefront of it. A lot of thought leaders at MIT have been at the forefront in terms of what a great innovation district looks like. And who comes to mind in that is Dr. Fiona Murray out of MIT and Phil Budden as well. They've written up some great work about what constitutes a great innovation district. I'll move on to Canada because I am Canadian, because I don't think it gets talked about enough. And I've had the pleasure of working in the Canadian startup ecosystem for a few years now. So Canada is a really great example, Toronto in particular, of where I would say about 15, 20 years ago, the government made a very systemic decision to really foster innovation within Canada. And that's innovation across tech and healthcare everywhere. And there's something called the Mars Innovation District in Toronto, and it's become world-renowned because it's a great example of integrating with the University of Toronto, also the University of Waterloo as well. And also, they've also developed something called the Creative Destruction Lab coming out of the Rotman Business School, which has now gone global. And I think the key lesson there is a great ecosystem integrates all the stakeholders in medicine and science and in business. So that's what they've done very, very well. And more recently, back to your manufacturing question, talk about learning agility. They've looked at that, Canada there was an area of development in terms of manufacturing, which became evident just like most parts of the world with COVID, right? So I think the lesson there is to always reassess where you're at, have that learning agility as an ecosystem, and take a very multi-staker point of view in terms of integrating the strategy and execution. That would be my key lesson. Again, I'm lucky. I think I have the best job in the world because I have an incredible foundation to build on. We've got King's College London, an incredible world-class university. We've got 3 incredible foundation trusts. We've got the trust. And I think what's unique, and I can't emphasize this enough, and this is probably maybe what other innovation districts can learn from us from, we've got the very proactive engagement of our 2 boroughs, Lambeth and Southwark. They sit on our boards. They have a say in what the vision of SC1 is, how we're going to execute. And again, back to reimagining innovation and health equity. That's our unique qualifier.
Thank you. Very interesting. I think you've kind of touched upon it, leading to my next question. Kind of the triple helix is often referred to a lot in life sciences innovation. So the relationship between academia, industry, and government. Kind of an open question to the panel, whoever kind of feels that they want to take it. But why is this so important, and what can we kind of do to encourage and facilitate it more in like the everyday working life, through that being the infrastructure or strategy? What can we do to make this better? Because I think everyone agrees it's a very key part of creating a life science ecosystem. John, I can see you've got your hand up.
Following on from Georgina's comments, it's absolutely integral that there are those links across industry, across academic research, and the infrastructure piece, and of course in terms of health outcomes, which is what we all benefit from in terms of what comes out of our academic institutions. The relationship's absolutely key. So just to touch upon that in a little bit more detail. So if I take Dundee as the example, because it's obviously the one I know the best, we've had a public-private academic third sector relationship since 1997. So we created a body called Bio Dundee, which is that centre of conversation, that centre of gravity through which we all coalesce and combine our resources to have a real focused effort. And that isn't just focused on one particular aspect or one particular angle. It is a combination of all those various organisations that are representative. And I would agree, having the local authority on board is absolutely key to that as well. We work very closely with our academic institutions. We're also one of the largest landowners in the area, and we're also the planning authority. So it's absolutely essential, I think, that we are seeing this conversation through the prism of ongoing development and a sustainable conversation over a longer period of time. But that's why in 1997 we created Bio Dundee, to bring together those various elements to make sure that we weren't missing a trick, that we weren't losing sight of the totality of our vision and what everybody has or what everybody's part is in that journey as well. So, absolutely.
You've been ahead of the game for a long time then. Georgina, do you have anything to add to that?
Yeah, I think that trifecta of engagement is critical. I do want to give credit to my colleagues in big pharma and big tech, and where I spent most of my career working for the Novartises, Roches, and Boehringer Ingelheims of the world globally, is that they're very much committed to that collaboration between the public sector. They always have been. But I think in the past 5 to 10 years, that has really become more of a priority. So I think that's really a great foundation to build on. So maybe 20 years ago, that was a challenge and you had to work very, very hard. But I feel right now that everybody's really extending an olive branch. I think we all recognize that healthcare is very complex, and that if you really want to have positive outcomes at the patient and community level, nobody can solve the problem alone. Not the private sector, not the public sector, it has to be an integrated approach. So I think that for me is very heartening that we're all moving in the right direction. I think it's going to, quite frankly, make my job a lot easier.
Agreed. And Suki, did you have anything to add to that?
Yeah, I was just going to say that I think the COVID vaccine trials program was testament to how the sectors can all work together to deliver that common goal. I don't think we could have done it without the government support, the vaccine task force that was established. The government bringing in the trial opportunities for us regionally, which was hugely important, because at the very beginning, we didn't know how that was going to play out. And then the partnerships that we formed between academia, the NHS and industry, we couldn't have delivered the vaccine trials without those collaborations. And some of us were just talking this morning about how the word collaboration has become really, really key, and we can see how working together can achieve so much more than working in institutional silos. So I just wanted to make that point.
Perfect, thank you. I'm just going to ask one more question, and then I think we will move on to some Q&A from the panel. So I think this is kind of just thinking about the future, and obviously when we provide this lab space, so at Snowsfield at Raw Street, we want to kind of think about future-proofing. So we hear a lot around the convergence of life science and tech and kind of increased personalised medicines. What do you think the kind of next and upcoming trends in the sector will be? And do you think this will have an impact on the space that we look to provide? A big question we get asked at JLL is, well, if there's going to be more tech, is there going to be less lab space needed? So kind of happy for whoever would like to take that question. Suki?
I was going to say one trend I'm seeing all the time talking to life science companies is about diversity and inclusion into trials. That's one of the hot topics right now. And I think anything we do in the future has to be reflective of that agenda piece going forward. I think the other things that, and this has been touched on already this morning, some of the key sort of considerations for startups and the larger companies we're seeing at the moment is talent. The people and skills is such a precious commodity right now, and so that will be hugely important in the future. And the costs are going up. Inflation is a clear and present danger, as is the rising fuel prices and things like that, and rising labor costs. So that will be another big consideration for companies going forward. And we're seeing a lot about companies talking more about the people and the planet rather than profits. That's the way the agenda is moving. And so that will be something to consider going forward.
Great, thank you. And Rachael, did you just want to add to that?
Yeah, just echoing on Suki's comments about, what people are looking for, or when they're creating these new businesses, creating these new startups, these new businesses that are coming into cities. It's not just about the space anymore, providing a lab space. It's that people element. It's that inclusive innovation. It's, what are we doing to consider our net zero? What are we doing to consider the future workforce, the investment in the talent? What are we doing to invest in our schools and our education programs so that the people who are working, their children are educated properly? What are we doing to support spin-outs of those companies? What are we doing to support the people who are coming through? So, we've talked before, mental health is going to be, huge. I think we've not seen the full impact of the pandemic yet, and we probably won't see the impact on mental health for another 2 years yet. What are we as as people who look after tenants and look after occupiers and who manage innovation districts? What are we doing to support people's mental health as we're going forward? So I think a big trend is that work-life balance, to focus on the people. That mentality that you're just a number in an organization. I think that the pandemic kind of saw to that we've got to invest in our people as well. So I think that's huge, investing in the mental health side of things, investing in a person's lifestyle as well. When we're looking at occupiers coming into a city, especially what we're dealing with, we've just done a large fintech letting this morning. A huge part of their consideration for coming to us was the cultural elements of life, their transport. They want green transport to be able to get to work. They want, a good lifestyle, green spaces where they can relax and enjoy. So there's a huge part of investing in the real estate, which I know Georgina picked on earlier about how imperative the real estate is. So yeah, absolutely, investing in the human side of things I think is going to be a huge trend moving forward.
Thank you. And I'll go to the Q&A now. It's kind of more on the real estate side, but kind of two questions. The first one being kind of what are the core facilities that are included within the cluster? I guess for whoever to take that question. And secondly, a bit of a trickier one, but it's around the kind of the ownership structure. So I think the university or trust, they tend to own the real estate themselves. And do we need the private sector to develop out this real estate on behalf of the public sector? And kind of where's that capital coming from? Does it need the private sector? So is that kind of public-private partnership essential from kind of a real estate point of view? Rachael, I can see your hand's gone up, so if you want to take that one.
I just a very quick answer from me. Yes, absolutely. Public-private sector collaboration is key, and part of what we did in Liverpool was we were watching our innovation district develop, and we were looking at the real estate side, the property side of things. So we created a commercial spin-out company called Scientech, which is looking after developing new science and technology spaces. And the reason is we understand the occupiers, we understand what they need. So we couldn't do that without the public and private sector coming together. So that's 25% owned by Bruntwood Sci-Tech, which is the joint venture between Bruntwood and Legal & General. So that's where that capital is coming from. So that private sector, public sector coming together, it unlocks enormous opportunity, and it allows us to work with tenants, to work with new occupiers, to build the right space and the correct space. We've commissioned a lab demand study in Liverpool to look at the lack of lab space and are we going to need it moving forward? The answer is yes, absolutely. But we've got to make sure we're creating the right lab space and the right stuff for the occupiers we're working with.
Yeah, couldn't agree more. And John, did you have anything to add to that?
Yeah, I think it goes to the point about long-term viability of many of these developments, particularly in the context of construction inflation and the pressures on development costs. So, the only way of taking many of these larger scale developments forward is by working through a public-private kind of relationship. And I think there's a number of different models that can be deployed. The current development in Dundee is co-funded by central government and the University of Dundee with support from Dundee City Council. But there are opportunities for joint vehicles, for partnerships, for other models of delivery, which we're more than open to. And I think, again, if you consider the commercialisation of much of what is coming out of some of our universities, and we've got some great examples, although they stick in my throat ever so slightly. So Exscientia, for example, which many will be aware of as a company, world leader in artificial intelligence-driven drug discovery and the biggest biotech IPO last year, is a spin-out the University of Dundee. But its main base is in Oxford. And the reason for that is because we did not have the infrastructure at the point in which they required it. So by looking at innovative models and de-risking some projects, because we have to be realistic that the private sector is not always going to come rushing in to take on bespoke projects of this nature, which really only work for one kind of industry, or perhaps a couple of others, but mainly life sciences. We need to look at how we help the private sector and how the private sector help the public sector to realise the full potential and not allow another Exscientia to leave the shores of Dundee to go to Oxford, although I'm sure they're very welcome in Oxford as well.
Great, thank you. And yeah, you're right. There's a million different ways you can kind of structure it and model it. And definitely really important. Georgina, do you have anything to add on that one?
Yeah, we do have an embarrassment of riches at SC1 because of our 3 hubs around Westminster Bridge, London Bridge, and Denmark Hill. And as you know, these are, as far as I'm concerned, as a Canadian, incredible parts of central London, right next to Parliament. And really for us, it's really getting our heads around the synergy across all the different sites. So for us, that's the first layer. And then making sure that we have that right balance of space, whether it's incubator, lab space, office space, hybrid space. And equally important that I think Rachael mentioned, and maybe I didn't mention, but I think we're very passionate about that community space, because we do want that coexistence of entrepreneurs, community, businesses. So it's not sort of an either or. And, we've got great developers on board that are helping us with that. So it's a very integrated approach. So I would say that's one layer in terms of the cohesion that we're establishing within SC1. But again, MedCity also does a great job of having oversight of all the clusters within the UK. And there's the benefit of understanding, where gaps are filled by different districts and where's our USP and where's our value proposition.
Yeah, I couldn't agree more. It's not just around, creating space for the full life science ecosystem, so the full cycle from incubator all the way to kind of corporates, but also you want that amenity space where you can brush shoulders with, the next scientist, force that collaboration and that innovation. And Suki, did you have anything to add?
I was just going to add that the NHS is an important adopter of the technology and innovation that's being created in any life science campus. And I know one of the big pharma companies once said to me, look, Suki, if the hospital, if we're doing all of this in Cambridge, for example, and Adam Brooks does not adopt the technology, the medicines that we're developing, the whole thing doesn't work. So that's an important part of the jigsaw, that the NHS has to adopt the innovations from all these life science clusters.
Fantastic. Right, I will ask one more Q&A and then I think I'll ask my wrap-up question. So a really good question. So how do you measure the success of these projects? Is it scientific research, the product of innovation? Is it increased employment across all social bands? So what would we deem these districts or clusters to be successful? Who wants to take that one?
I think it's all of them.
Yeah.
I mean, that's the simple answer. It's no longer, if I go back and reflect on our mission, reimagining innovation and health equity. So at a high level, those are our metrics, and I don't have all the answers. It's the third week on this incredible opportunity for me, but that's something I'll certainly be working with the board on and our stakeholders in terms of what are our baseline metrics currently. And as we move forward, how do we measure our success? And I think, Boston and MIT have, done an incredible job in terms of looking at their outcomes. So I think we can definitely learn from them, as well as the Toronto district that I mentioned.
Perfect. Now, to wrap up, I'll ask I'm going to ask the same question to all of you. So I'll start, Rachael, with you first. So what do you think is the greatest opportunity for the UK life science economy? And also, what is something you think we could be doing better?
I think the biggest opportunity we've got at the moment is the global light that was shone on this sector during the last 2 years. We've had young people using words like zoonosis in their classrooms and, understanding what these words mean. I think that impact hasn't been tapped into yet. Of this has been, a huge, you couldn't get away from the pandemic, and it's shone a real light on how important this sector is, the work this sector does. I think beforehand it was kind of seen as it goes on in the background, the impact, it's not, we don't directly hear of it. And then it all of a sudden became, it was on your TV every night. You all of a sudden know the name of the health workers, the top health workers in the country. So I think that's been a huge opportunity, and coming off the back of that we've got an opportunity to inspire the next generation through the work that we're doing, and it's become, these names that we're dealing with, the top professors, have become household names, and the language that we use on a daily basis in our own jobs have become language that is used in a Key Stage 2 and Key Stage 3 classroom. So I'd see that as a really big opportunity to create tangible aspiration in young people that should be able to inspire our next generation, our next workforce of the future. So yeah.
Great. And John, if you could, same question for you.
Sorry, Ellie, I missed the start of the question. My audio went.
Don't worry. So what do you think is the greatest opportunity for the UK life science economy, and what is something you think we could be doing better?
Thank you very much. I mean, just to follow on from what Rachael said there, I heard her response. I think it's absolutely integral that we learn the lessons. So starting with the second point first, to learn the lessons of the last 2.5 years and use that to advance progress in pharmaceutical research and the development of our response to that. I think, as I mentioned earlier, the onshoring of much of that opportunity, I think, is going to be a trend that continues. So that means that we need to look at that pipeline of investment, that pipeline of development, and also the pipeline of talent to make sure that we continue to be an attractive destination to attract those skills and talented individuals, not just from the UK, but globally. And I know, the dreaded B word, Brexit, will inevitably have an impact on our attractiveness, but actually our academic institutions are hugely influential. And that shouldn't be a barrier to using that as a mechanism for further development. So I think there are some real opportunities for growth there. And infrastructure, I think, is a consistent issue that has been raised in every conversation that I've been involved in nationally and locally. And it will continue to be, I think, one of the challenges, because the time it takes in which to identify the scale of demand, to identify the needs of a particular cluster, and then to get spades in the ground is too long at the present time. And we are constantly working to catch up with ourselves, which in some senses isn't a bad space to be in, but we need to catch up with ourselves. We need to be ahead of that curve, and we need to be anticipating demand. So I think there's much more that we could do going forward as well. And I think the UK, in terms of life sciences, is a huge success story. And long may that be the case. But, from the fantastic, influential people on this call, I know that there's going to be far more challenges that come from the sector back to local government, national government, and all of the various partners to say what more can we do to deliver on that front as well.
Great, thank you. And if I'll come to Georgina and finish off with you, Suki. So greatest opportunity for the life science economy, and what's something we could do better?
Yeah, I mean, I really respect the UK for always being so proactive. There's the life science vision that was recently updated based on the work from Sir John Bell, a fellow Canadian. What I wanted to say is, I think back to the original question, I'm very passionate about knowing what you stand for, knowing what your core strengths are, and executing them exceptionally well. So I think MedCity does a great job of having an overarching view. And I think for all the interest in Innovation District, it's just making sure that we're all complementary and collaborating well. I think that's really important, and doing what's in the best interest of the community locally and globally, because I think that's also going to help put the UK, it's already on the global map. So I don't want to say to put us on the global map. I think we're already on the global map, but how do we amplify that globally? And it really comes down to focus and exceptional execution and knowing what you stand for. So I think it's those complementary but not competing strategies.
Great, thank you. And Suki?
If I start with, I think the opportunities we could do better in is data. Our data assets is, it has huge potential. And when you talk to startups and large pharma companies, they want that access to data. And I think there is so much more we could do to make that process easier for industry. And the other point I already touched on is about diversity. In the end, even with the COVID vaccine trials, we didn't do as well as we could to recruit into those trials that was reflective of the populations that we were recruiting from. And there's a huge amount more that we could do in that space. And in terms of our strengths, echo everyone else's comments. I think the UK has some of the leading universities in the world. The NHS is our absolute prized asset, and we have such incredible talent in this country. So we can only grow from strength to strength.
Completely agree. Well, thank you, everyone. I think that's all we've got time for today, but thank you to our panel for that fantastic discussion. I'm going to pass back over now to Catherine, who's going to wrap up, I think.
Yeah, lovely. Thanks, Ellie. And thank again to all our panelists for a great discussion this morning. A really great way to kick off Real Estate Live UK for June, and so much positivity. Such a great success story, as you say, for UK, but lots of challenges and still things to achieve. But again, a huge thank you to everybody. Now, before we leave today's session, I just wanted to make you aware what else is happening today, because there's lots more to get involved in. Immediately following this, we are heading over to Mid Sussex, where we're going to find out more about why Mid Sussex is a place of partnership. We are then moving over to Waltham Forest, where we're going to be talking about the industrial approach to the industrial sector, and then talking about building garden communities and how do we embed that culture at 12:30. And then in the afternoon, we have a session on generating footfall in partnership with Shop Happy. So loads happening today, and a reminder to everybody that tomorrow we are also in Liverpool physically with a special investor tour, but the main panels are being streamed live, so you'll be able to listen to those on Zoom, and in fact everything that's happening over the next 3 days will be available on our YouTube channel by the end of the week. So if you've missed anything, or you want to revisit any of the discussions or share them with colleagues, then please do go to the Real Estate Live YouTube channel and stay up to date. Always follow us on LinkedIn so that you know exactly what's happening and when. But for now, thank you once again to everyone who's listened and taken part this morning, and we look forward to seeing you all again soon. All the best and goodbye for now.